Hello, my name is Jacqueline Jackson, and I work as a chiropodist at the Leamington and Area Family Health Team. Currently, 1 in 3 Canadians has diabetes or prediabetes. Previous research shows that those 20 years of age today face a 50% chance of developing diabetes in their lifetime. Diabetics account for 70% of non-traumatic amputations in Canada each year. The American Diabetes Association estimates that over half of lower limb amputations related to diabetes are preventable. Our national estimated healthcare cost for diabetes is $75 million annually to treat and manage diabetes and related conditions. So what does this mean for you? Understanding how to safely manage your blood sugar, as well as understanding the importance of good foot care and footwear, are paramount in managing your diabetes successfully. You may be wondering why or how diabetes affects your feet. Uncontrolled or fluctuating blood sugars over time can affect your feet in many different ways. Firstly, excess blood sugar decreases the elasticity of blood vessels and causes them to narrow. Another effect is damage to nerves, also known as neuropathy, which is a lack of sensation or feeling in your feet. As you can imagine, these two complications make up a very dangerous combination for your feet. So how does neuropathy present? It'll present as numbness, tingling, burning, or odd sensations in your feet. Some of the consequences can include not being able to experience or feel temperature changes, foreign objects, injuries, areas of pressure, or damage to the skin and overall foot. This can be especially dangerous in feet that have bony prominences, such as bunions or hammer toes, when a person cannot feel areas of pressure. In order to test for neuropathy, it's important that you see your chiropodist or physician annually for your diabetes foot screen. When you take off your socks and footwear, it's important to allow your feet to acclimate or get used to the temperature in their house before you shower or bathe, or look after your feet. This may take a few minutes and is especially important when coming inside from cold weather. Your daily care routine is best suited around the time that you shower or bathe. Testing the water temperature is important as we want to make sure that the water is not too hot or too cold. Either extreme can impact your skin integrity and foot health. Neuropathy can also affect your hands, so it's important to test the water temperature. You can either use a thermometer, with the appropriate temperature being between 32 to 40 degrees Celsius, or you can use your elbow. This is just to make sure that the water feels okay and is safe to use. So you're going to start by lathering your feet with soap and water. It's good to do this at a normal time you would bathe, but every day is important to keep your feet clean. Use a mild soap. Don't use a deodorant or harsh perfume soap. This is harsh on the skin. So once you start soaping and lathering your foot, you want to start on the top of your foot with circular motions, washing the top of your foot and toes. You want to make sure that you're getting between all your toes and removing any dead skin, dirt, or debris from between the toes. Then you want to finish by doing the underside of your feet and your heel. We don't want to soak the foot. Soaking the foot for extended periods of time or often can cause issues with either breakdown of the skin, any cuts or tears in the skin. Bacteria can get into those cuts and tears and cause infection. So soaking is not recommended, just bathing daily. After washing your foot, you want to make sure you rinse all the soap off, especially between the toes, and then dry your foot. When you dry your foot, again, make sure you get in between the toes and dry in between the toes well. If you have trouble reaching between your toes, you can use a hair dryer on a cold setting, but it's really important that between the toes is kept clean and dry. This minimizes any chance of a bacterial or fungal infection from starting. If you have trouble washing or getting between your toes, you can use a long-handled soft brush to go between the toes. You can use soft brushes to get the top of your foot and the bottom of your foot. There's a number of devices that can help you reach your feet if you're having trouble. Otherwise, you can ask a family member to help you. Once your foot is washed and dried, you can apply lotion. It's best to use, again, a lotion that is not heavily perfumed. So when you apply your lotion, you want to get the tops of your foot and toes, as well as the underside, and don't forget your heel and ankles. Now, once again, you don't want to get lotion between your toes. If you're concerned that you did get lotion between your toes, simply remove it with a dry towel. Between your toes is a dark place that won't dry easily, and so we don't want moisture in there that may allow for a fungal infection or a bacterial infection to get going. When you've finished doing your routine, you want to make sure that you do a visual inspection. So what you're looking for is any open areas on your skin, any color changes, any red areas, anything that looks irritated or out of sorts. If you have trouble seeing the bottom of your foot, you can use a handheld mirror to inspect the sole of your foot. And look between your toes. If you have trouble seeing up close, you can use a magnifying glass. If you find anything wrong, if you find a break in your skin, it's important that you get it treated right away. So topical antibiotic and a clean bandage after you've washed the area is the safest way to treat any open cuts. Each day you're going to inspect that lesion. If you do find something wrong, and you're going to ensure you treat it every day with your antibiotic, and if it's not healing up, you're going to call your chiropodist or family doctor to get that looked at. The next thing you're going to do is your nail care. It's always important that your feet are clean before you do any nail cutting, and it's important that the nail cutter that you use is also cleaned before you use it. You don't want to throw it in the drawer and get it out next time because it will have bacteria on it. So you want to make sure that you've cleaned your clipper. When you cut your toenails, you want to make sure that you're cutting straight across. Once you're done trimming, you want to file. This is very important. You want to make sure you file so that there's no sharp corners or anything that's going to catch or cut into a toe beside the other toe. So you want to make sure you file anything. When you cut your toenails, it's important you don't cut too far back. Cutting too far back can cause damage to the nail bed, and it can cause an increased risk of infection as well. So once you're done trimming your nails and filing your nails, you can just do some exercises with your feet, some rotations, moving your toes around. This helps you understand if you have any limitations in the motion of your foot, and it helps stimulate good blood flow and circulation. So once your lotion is dry and you've done your inspection and you've done your exercises, you can put your diabetic socks on. We recommend diabetic socks because they have loose elastic, won't cut in and cut off your circulation, and they don't have seams that can cause rubbing and irritation to your skin. We like light colored socks, white colored socks. It's really important because if you have neuropathy and you had any injury to your foot while wearing the sock, when you remove the sock, if you didn't feel it happen, you might see the blood or discharge from the lesion on your sock. So it just helps you bring awareness to any injuries. So we're going to put our socks on. Now, as a diabetic, you always have to wear something on your feet in the house. And if you have neuropathy, there's no option. You have to wear something on your feet in the house because you would not feel if you stood on anything and you would not feel the injury. So it's important to wear a footwear in the house, particularly something with toe covering that protects your toes from stubbing against furniture. So wear something in the house, orthopedic sandal or shoe that's just for in the home. Now, moving ahead to footwear, I want to discuss a good shoe. So when you look at this shoe, what we notice about this shoe is it has a nice wide and deep toe box. Now what that does is it helps prevent any rubbing if you have any bunions or hammer toes so that they don't rub on the tops or the ends of your toes. It has a nice, strong, firm heel counter so it doesn't collapse. It supports the foot well. It doesn't bend in the center. We don't want the shoe to be able to bend and fold in the center. It's okay if it bends at the toe because this helps with walking. The other thing that you might want to look for is a shoe that has an insole that comes out. This allows for insertion of an orthotic that maybe you wear or your chiropodist might recommend. So that insole can come out and you can fit your custom insole inside. Now before you put on your shoe, it's always important to inspect inside the shoe. You want to make sure that there's no heavy seams that might irritate the skin, or make sure there's nothing in the shoe. There's lots of things that could find their way in your shoe, and if you have neuropathy and you're not aware that they're there, you could do a lot of damage putting your foot into your shoe with that foreign object in there. So once you've checked that there's nothing in your shoe, you can go ahead and put your shoes on. These are a lace-up shoe. You always want to do your laces up. If doing up laces is difficult for you, there are other options like Velcro or elastic shoelaces that you can use. This includes our at-home foot care demonstration. It's important to know that not everyone has the ability to do this on his or her own. Having someone at home like a relative, caregiver, or professional to help with your daily routine is vital in amputation and harm prevention for your feet. In order to maintain good foot health and avoid these terrible consequences, please make sure to ask and see your chiropodist annually for a diabetes foot care exam. Check with your diabetes team regularly, as well as your physician. Maintaining good foot health also means making sure to take your medication as prescribed, getting good exercise, and having a healthy diet. Thanks for joining.